Thank you for joining us today. I'm joined by two Scots in our senior COVID Division Command, Brigadier General Scott Sherman and CDPHE Incident Commander Scott Bookman, to give you additional updates. We're going to tell you some additional news about our vaccine distribution efforts. First, I want to start by sharing the latest COVID numbers. Yesterday, we had 1,291 positive cases. Tragically, we have lost 6,024 Coloradans, and my condolences to the families and loved ones of everybody who didn't make it. Our hospitalizations increased by 17. It went above 300 again, now 303 hospitalizations. We don't yet know if that is a trend or that is the normal daily fluctuation that can occur. We hope it's not a trend, but it's an important reminder to everybody that not enough people have yet been vaccinated for there to be a certain or definitive downward trend in hospitalizations. There's absolutely enough people who haven't had COVID, who haven't gotten vaccinated, where that number could increase again. We hope that this 17 is not an increase. 303, obviously, well below our capacity. We're completely comfortable with where we are in hospitalizations, but that's still 303 of our fellow Coloradans currently in the hospital due to COVID. Many will make it out of the hospital fine after a few harrowing days. Others will not make it out, and our heart goes out to them. There'll be more information in the coming days about whether this is a trend or just the normal fluctuation. Our positivity rates continue to be low due to the testing. Very important for us to know where we are with COVID. So again, anybody who has symptoms of flu-like symptoms, fever, cold-like symptoms, aches, please get tested. It's so simple. It takes a few moments of your time. You can be saving your family and your friends a lot of heartbreak by identifying that early and making sure to quarantine yourself if you have COVID for 10 to 14 days. It's important during this phase to continue to be cautious, careful, wearing masks around others, limiting social interactions whenever possible. We're very close to being through this, but again, there's enough people that haven't been vaccinated and haven't had COVID that, of course, there can be another increase, and there are parts of the country that are currently seeing increases. So on February 26th, I was announced that we would start vaccinating about 1 million Coloradans in phase 1B3 by March 5th. That was anybody over 60 is currently eligible for a vaccine, anybody 16 to 59 with 2 significant pre-existing conditions, and our grocery and ag workers. We also announced that soon we would be beginning 1B4, that's anybody over 50 in our state, and also our frontline essential workers. So, I mean, that's restaurant workers, postal workers, local and state government. We had estimated March 21st as the start date for that group. We always update the information with what we actually have with regard to vaccines, and we're very ambitious about achieving our goals. Early on, we set the data-driven goal to vaccinate 70% of Coloradans 70 and up by the end of February, and we reached that, and I'm proud to say that as of right now, we are at 76% of those 70 and up. And we hope that there are more people 70 and up that are willing to get vaccinated. We would love to see that number get to 80 or 90% because they are the highest risk factor. 3/4 of our deaths are people aged 70 and up. So if you are aged 70 and up, our message to you is you are still a priority. If you didn't get the vaccine until, and we're waiting, now's a good time. And I, heard from somebody in her late 70s who just wanted her friends to have it first, and now she saw that it was no big deal, so she's going in to get it. And that's fine. We would love to continue to focus on prioritizing those who are most vulnerable as we expand eligibility. Now we are vaccinating the 1B3, anybody 60 and up, 2 pre-existing conditions, ag workers. I was at JBS in Cargill and Fort Morgan in Greeley. And soon we will be moving to 1B4. It's important to point out that 1B4, by that point, will have reached about half of our state's population being eligible with all the groups until then, and then everybody 50 and up, and all of the restaurant workers and postal workers and so many other frontline workers. Over the last 4 weeks, we've averaged about 200,000 Pfizer and Moderna vaccines each week. We expect that to increase. It already is increases. Johnson & Johnson, 40-some thousand, down to 7,000. We knew it was going to go down. Originally, they told us 0. We were glad to get 7,000 this week, or 6,500. We'll go back up in the coming weeks, and we're very excited about that as well. To ensure that we're prepared to deliver higher volumes of vaccines into arms, we're ramping up our ability rapidly to administer the vaccines through the 6 state-run community vaccination sites that are in counties across the state. These sites will be able to do 6,000 per day. They get more, once we get the vaccines, they'll get more vaccines into arms as quickly as possible. We're currently at roughly the level of capacity for our normal private system, meaning the hospital system, the pharmacies. They are essentially administering about as many as they can. Perhaps they can push a few more. But as the quantities go up, the normal, regular way we do vaccines is no longer enough. And that's why we expect we'll be running these sites for a 6 to 12 week period until we get through this surge and everybody gets vaccinated. So frankly, it's the best problem to have. It means we have more vaccine and we need to distribute more so we can get it more into arms. So we're very excited about the time frame for the 6 state-run clinics. Some have already been run under different iterations. The Scots will give updates on that. But now that we have a better sense of the quantity of vaccine we're getting, we are moving up the timeline for Coloradans in phase 1B4 to March 19th. So we will begin that 2 days ahead of schedule, and that's roughly at that point about half of Coloradans are in a group that is eligible. It's everybody 50 and up will be able to get a vaccine starting March 19th, along with restaurant workers and critical essential workers. Last night, President Biden directed that all Americans should be able to receive the vaccine by May 1st. In Colorado, we always aim to do better. We're very competitive, and we do expect, and we're able to announce today, that we expect we will be there during the by mid-April. So we will have that date in the next week or two as we further refine our supply projections and delivery projections. But we expect that every Coloradan will be eligible for the vaccine by mid-April. And currently on March 19th, we'll be at about half of Coloradans that are eligible, and we'll work on those in the coming weeks. Look, this is a race to vaccinate the majority of our population in our state and our nation. In many ways, it's one of the greatest undertakings in recent history. It's like our 21st century moonshot with only a matter of weeks and months to get there. We now have the tools we need, the people-powered infrastructure, the scale. We're ready to vaccinate more Coloradans faster than ever before. We simply need the vaccine, and the good news from Washington is the vaccine is coming. I owe a debt of gratitude to our frontline healthcare heroes, local public health authorities, COVID response teams, Joint Vaccine Task Force, Colorado National Guard, Department of Public Health, our equity leaders. We've had over 70 equity clinics across Colorado in underserved communities, and we're continuing to step that up as well. So the long and the short of it is every Coloradan age 50 and up will be eligible March 19th, along with restaurant workers, postal workers, county and city workers, and so many others who have to go into work every day. And then every Coloradan will be eligible for the vaccine by mid-April. I'll now turn it over to Brigadier General Scott Sherman for a further update.
Thanks,
Scott?
Governor. Hey, good afternoon, ladies and gentlemen. Just want to give you an update on phase 1B1 and 1B2, our vaccination goals. As the governor mentioned, age 70 and plus for all Coloradans. We're 107% of our goal. It's actually 76% of the total population. Then for 65 to 69-year-olds, our goal was by March 5th, 55%. We're actually over that goal. 113% of that goal. We're actually 63% of the total population have been vaccinated there. And then for child care workers and our educators, our goal was 70% by March 5th. We're actually over that, 118% of our goal. 108,000, that's 90% of our educators and child care workers and education staff. So we're certainly well on our way to get these critical populations totally vaccinated. As the governor said, it's certainly our goal to get 80% or higher of this population vaccinated, both with 2 doses, so that they can go back and make sure they're safe from COVID-19. Next slide, please. I want to give an update on the community vaccination sites. As the governor mentioned, 6 sites. On March 17th, Mesa County at the Grand Junction Convention Center. They've been doing that as a county one. We're moving it into a state site and getting them prepared with state resources so they can do 6,000 doses per day. And then also in El Paso County at the Broadmoor World Arena, partnering with Centura Health. They'll be starting theirs on March 17th. And as the governor said, we'll start out small, but as soon as we get allocation that we can do 6,000 a day, we'll certainly get that ramped up there. Then on March 22nd, Adams County and Centura Health again for Dick's Sporting Goods Field. We'll get that one operating. Then up in Larimer County at the ranch, we'll be starting that site. And then in Pueblo at the State Fairgrounds, they are already operating a county site there at the Pueblo Mall. We're going to be moving that to the State Fairgrounds, so they have the capability to have 6,000 per day. That's a partnership with Pueblo County, State of Colorado, and Centura Health. And then we're working right now on Denver Ball Arena. That will be towards the 1st of April. We'll get that operating so that we can get that site operating too to make sure that the Denver Metro is covered. Next slide, please. I want to give you an estimated weekly vaccine supply. We've been told by the CDC in the next 10 weeks that the U.S. will be receiving 200 million doses. For Colorado, that means over 3.4 million doses that we'll be receiving in the next 10 weeks. What we know right now is through March 28th for Pfizer and Moderna. We are receiving, as the governor mentioned, 6,300 Johnson & Johnson next week. We have already received in the past 45,500 and very encouraged by the support for that vaccine and really everybody that's really wanted to have that vaccine. So we expect here the last week of March to get 67,600 vaccine, along with an increase that Pfizer and Moderna have announced. So we are expecting somewhere in the neighborhood of 350,000 doses, and we certainly expect that to increase. And by mid-April, we're expecting over 500,000 doses per week. That's why we're getting these community vaccination sites established. Because right now, our base, we're going to need those community vaccination sites to make sure that we get all the vaccine that we receive weekly. We're able to administer it and get it in Coloradans' arms so we can get well on our way to getting the population vaccinated and we'll get to herd immunity. Next slide, please. So just on how to sign up, the registration for every site in every health system that's helping with this or county will vary. We'll have information out next week, March 17th, where we'll provide this information so that all Coloradans can start signing up for these sites and get vaccinated.
And that's also, so if you're in the 1B3 group, if you're over 50, it doesn't mean you can sign up everywhere today. It starts March 19th, but everybody will be updated March 17th. So 2 days before you're eligible at the latest. If you're a restaurant employee, if you're 50 and up, if you're a postal worker, you will have all the information you need to sign up. Some might be putting that up a little bit sooner, but all of our folks should be updated 2 days before that goes live.
Right, correct, Governor. I'll hand it over to Scott Bookman to discuss Phase 1B4.
Thank you, General Sherman, and thanks to your entire team for all of your work to get vaccine moving across our state as rapidly as possible. And once again, I want to take a moment to express my gratitude to all of our providers, our healthcare systems, our local public health, our federally qualified health centers, our retail pharmacies, who are all working so hard to provide vaccine to all Coloradans who want it in all the ways that we can do it. This is a monumental effort. It requires flexibility, it requires collaboration, and it requires patience. But as our supply increases, we are really making great progress in our race against this virus and ending this crisis as quickly as possible. We are just so fortunate to have an incredible team working across the entire state to get us there. As the governor indicated, we're proud to announce today that we will be opening up eligibility for all Coloradans in Phase 1B4 on March 19th. Next slide, please. 1B4 is a large group. Again, as we start moving through this phasing, there are a lot of people who are probably double counted, but we do estimate that there are up to 2.5 million people in this phase.
What that means, if you're like 62, but you're working a restaurant, you're already eligible because but you're counted in both the restaurant number total and the 60 and up total. So I just want to make sure people know that as they look at these numbers.
Thank you, Governor. Absolutely. So there is some double counting, but we wanted to make sure that we've got some clarity on how large this group is. Like I said, people in this group will be eligible, but it still will require patience as we move through this phasing. So in 1B4, we have food and restaurant service workers, we have student-facing staff in higher education, manufacturing, postal service, specialized transport, people who are 50 to 59, and several other groups, including faith leaders, frontline journalists, and those with one of our high-risk conditions who are between 16 and 49. Next slide, please. So in this essential worker list, it is a pretty broad group. This is designed to provide vaccine to those who must do their work in person, who may be working indoors in places where ventilation is not at the highest quality, and so that they're at higher risk because of the work that they do and where they do it. Next slide. So for those who are in 1B4 because of their essential worker category, this is employer-based registration. So our vaccine task force can help employers connect with a provider, but it is important that employees who are in this category first work with their employer rather than going directly to a provider. For any of those employees who want more information on how to connect with a provider, please go to our website and fill out the clinic form. Next slide. For those who are 50 and over, and those who are 16 to 49 with one of our higher risk conditions, you can go and sign up directly with a provider to make your appointment. You can find a list of our providers on our website, or you can call our hotline to get more information on what providers have vaccine and are able to schedule appointments for you. Next slide. And then, as the governor indicated, we do anticipate opening up eligibility to the general public in mid-April, depending on the total federal supply. And while we will open up to everyone, our providers will still have their discretion to prioritize those who are at higher risk in our more vulnerable categories and who haven't received vaccination yet. Governor, I'll turn it back over to you.
Thank you, Scott. Thank you, Brigadier General. I want to reassure everybody who's eligible now, if you're 60 and up and you still haven't gotten an appointment, you will be able to get your vaccine. That doesn't go away March 19th. If for some reason your appointment is after March 19th, you are still being prioritized. We are absolutely encouraging providers to use their discretion to prioritize anybody 60 and up, 70 and up that hasn't gotten a vaccine yet, maybe was waiting to see or wanted the kind of initial sort of fuss around it to become less. It's much easier now. So if you are 72 or 65 and haven't yet gotten your vaccine, we encourage our providers to prioritize your appointment so that you can get that. As you know, the data shows that the risk of severe illness and death increases significantly with age. And that rise becomes much steeper after age 50. Which is why we are opening up to everybody age 50 and up before the rest of the population on March 19th. That goes back to our strategy of saving the most lives and ending the pandemic as quickly as possible. Saving lives means prioritizing those who are at much greater risk from the virus of death or severe hospitalization. I also want to mention the storm warning. Obviously, on top of the public health crisis, the storm warning applies to a large part of our state, not our entire state. The highest snowfall is expected along the Highway 25 corridor down from the northern border of our state down through Colorado Springs. As of 12 p.m. today and through Monday, I've activated the Colorado National Guard to be responding to search and rescue requests through the Emergency Operations Center. But let me tell you, you don't want to be one of those people that has to be found and rescued. That is a difficult experience, and we encourage you, if it's snowing heavily in your area or beginning to snow, please, stay in, get where you need to go, stay there for the weekend. Don't go out and about. Don't run errands that you don't absolutely need to. Navigating our way through this storm will take all of us. And you don't want to be one of those that winds up in a roadside ditch and relies on our National Guard to help rescue you and bring you to safety. So if we avoid situations that put ourselves at risk to begin with, we can make sure that our first responders are able to rescue anybody that really needs rescuing in this winter storm. So stay off the roads where you can. Stay at home or wherever you're going to stay for the 2 or 3 day weekend through the snowstorm, and we'll get through this okay. CDOT and Colorado National Guard are activated, ready to go. We're going to do our very best to clear those roads and get back to normal as soon as possible. Thank you all, and with that, we'll get to questions.
To all of you, This is Andrea Dukakis, CPR News. And just a quick point of clarification, and then I have a question. I think originally, and this isn't a big difference, but you guys were going to do 1B4 on March 21st, so it moved up a couple days, if that's right. And then the other thing is, for those in the general public, can you give an estimate about when the last Coloradan adult who wants the vaccine will get their first dose?
Yeah, so both of those, yes. The announcement today is that we're moving up 1B4 by 2 days. It will begin March 19th. If you're over 50, if you're a restaurant worker or a postal delivery or any of the other essential jobs, you will be eligible starting March 19th. And there are some sites that allow you to sign up today, but all of those will be updated by March 17th for you to be able to sign up. And it's also important to note that if you're 52 and you're ready to go, it doesn't mean everybody who's 52 will be able to get that vaccine March 19th. That's when it starts, right? And then it is a process to get through that group. We also announced today that every Coloradan will be eligible by mid-April. We expect to have a firmer date in the next week or two, and that'll be based on additional transparency into future vaccine supply that we don't have now. That is the start, Andrea, as you indicated, of when everybody will be eligible. We don't have any additional information on May deliveries other than what's in the public record. But at this point, from our vantage point, I agree with what President Biden has indicated. We expect that Coloradans who want it will be able to get the vaccine by the end of May. It depends on national vaccine supply. Could it go into June? Could it be done mid-May? Absolutely, those are possible. But the range I'd put on it is sometime between mid-May and early June. Every Coloradan who wants the vaccine will be able to have it, and every Coloradan will be eligible by mid-April.
And is that the second dose, first dose and second dose?
That's first dose. First dose eligible mid-April, so those folks would be getting their second dose in May. If you get your first dose in mid-May, you'd obviously be getting your second dose in June. So this is the first dose. Some of them will only need one dose because it's Johnson & Johnson, and they're done. 2 weeks later, they're immune. Others will need 2 doses, and that would be 21 or 28 days later, and then 2 weeks after that, immunity.
Thanks.
Governor, this is Jason Grenauer calling from Denver 7. So you said that the mid-April is based on current supply.
Yeah.
How far out do we know supply to be right now? And does that mean that if there are some unknowns that with more supply, that number could even move forward?
Yeah, I expect that within the next week. Right now, we're getting. So let me start again here. We're getting about 3 weeks of supply projections. The federal government has also started giving us longer-term supply projections with a greater degree of variability, but some sense of that future supply. We're also aware of what federal contracts with Moderna and Pfizer and Johnson & Johnson require. We don't have any additional transparency other than what's been stated about their ability to meet those goals, but at this reason, we don't have any reason to believe that they won't be meeting their contractual obligations. So based on that, we're able to give a range by mid-April. Every Coloradan will be eligible. Within the next week or two, we will have a lot more transparency into that April supply, and we will be able to assign a date in April where that can begin. But in what we're able to say today is we have a very high degree of confidence, and we're willing to say that by mid-April, every Coloradan will be eligible.
And you're announcing this on a Friday right before a large-scale snowstorm hits. A lot of the mass vaccination sites and clinics have been canceled. Are those being taken into account for this timeline, and will that impact either that March 19th date or the mid-April timeline?
Yeah, and I'll go to General Sherman. First of all, check with your provider to see if your clinic is on or off. It depends where you live and what their plans are, and it depends what the weather is. Those vaccines are still here. They're ready to go. We want those providers to reschedule those as quickly as possible. The vaccine is already in state for your vaccine. You will not lose your vaccine. You will not lose your chance of getting it. Work with your provider. They will likely notify you about the reschedule if they have to cancel. General Sherman?
Yeah, thanks, Governor. Yeah, they have rescheduled, so make sure you check in with your provider on that. We've also moved doses that can't be used next week due to the cancellations this week. We've moved them to other providers that do have appointment availability and the staff available to get shots administered. So we're really working with all the providers and local public health to make sure that that the allocation that we get next week is properly distributed across the state so that we can get every Coloradan vaccinated.
that the phase 1B4 is 2.5 million people, and there might be some plus or minus a few 100,000 or whatever, but are you going to be able to vaccinate everybody in 1B4 before you open it up to the public, and will there be any kind of issues with that? And then I have a follow-up as well.
Yeah, so first, no, we never can vaccinate any. If we waited till we vaccinated an entire category before we moved on, the rate of vaccination would significantly slow down. So that's why before we even reached 70% of 70 and up, we opened up to 65 and up. Had we had a narrower and narrower group, we simply wouldn't find enough people to be able to do the vaccine. So you want to get to a reasonable amount. It could be 30, 40, 50, 60% of a group as you open it up. You don't want to be where you're really scrounging around to find people and there's not enough arms to get it. And the priority is ending the pandemic, right? Saving lives, ending the pandemic. Saving lives means those most at risk. And then ending the pandemic means any arm, get it in, use it, don't let it sit on a shelf. So we work with all of our providers to make sure that they use every dose that is provided within 4 days. If they don't, we work with them to reassign it to get it into an arm. As General Sherman indicated, if there are those that are being rescheduled in the storm, and let's say they're rescheduling it, 10 days later or a week later, we then move their vaccine to a place that will use it within a day or 2 or 3, and then we will backfill only a day or 2 before what they need for their actual clinic that's rescheduled. We don't want any vaccine sitting on shelves. So yes, by mid-April, we don't expect that group will nearly be completed, but we will have made sufficient progress through that group that we need to open it up to additional people, and we expect that to be by mid-April.
Will folks still be prioritized?
Yeah, so just as now, we are encouraging all providers to prioritize those 70 and up. There's, if you are 70 and up, you should have been able to get the vaccine, but there are those that have been waiting for whatever reason. Maybe it came to their nursing home and they didn't want it then, and now they see all their friends got it and they're willing to get it. We absolutely continue to encourage our providers to prioritize those that are most at risk, and it's important to know that if you are 70 and up, if you are 65 and up, just because the eligibility is expanding doesn't mean that you are not prioritized and that we want to protect you as quickly as you're willing to be protected.
Hi, Governor. This is Patty Nyberg with the Associated Press. My question is about nursing homes. Since the CDC updated its guidance, is the state also doing so for indoor visitation?
I'll go to who has that. Scott Bookman.
So we are currently evaluating the CDC guidance and anticipate updating our guidance in the coming days to reflect that, which will be allowing significantly more indoor visitation in the coming days.
Hello, Governor. I'm Jesús Carrasquer para Noticias Univisión Colorado. Gobernador, ahora que ya está aprobado el paquete de estímulo económico, ¿cuándo se espera lleguen más recursos al Estado y para qué áreas estarían dirigidos?
Los ciudadanos quienes recibieron las $600 hace unas semanas ya califican a recibir el 1,400 más muy pronto en la próxima semana. El dinero que viene del gobernador federal. En cuanto al dinero para el Estado, empezaremos un tour por el Estado para escuchar, oír todas las ideas de coloradenses, la mejor manera de utilizar estos recursos para mejorar nuestra economía.
Intervene with 9 News. More of a sort of a broad-based question about what do you now think that June will look like in the state of Colorado, knowing everything that you know and everything that you've announced today in terms of mass availability of vaccine? What do you think June's going to look like around here?
Well, we fully expect that people who want to be vaccinated that are 16 and up will be able to be vaccinated by the end of May, which means that for that latter part of that group, their immunity would begin by the end of June. But we will have gotten through much of the population by then. For those who are vaccinated in early May, for instance, their immunity will start at the beginning of June. So we are in for a more or less normal summer. It'll be a lot more normal than last summer. folks will be confident in their protection. We await the approval of vaccines for people 12 and up. They're currently enrolled clinical trials. We certainly hope that happens before the next school year. Obviously, as long as the parents and grandparents are vaccinated, there's significantly less clinical risk for children, but not zero clinical risk. But I, with the great degree of confidence, signed my own kids up for summer camps this summer. They'll be excited to participate in them. Last summer, they were able to do some, but it was slim pickings and very challenging. So I'm encouraging, and I'm encouraged by the rate of vaccination. I think we're in for a very strong tourism season as well. And I think we're very excited and relieved to be getting through this in that June and July timeframe. President Biden said July 4th barbecues in your backyard, and I think absolutely that'll be something that occurs across our state and across our nation.
Hi, this is Anisha with 9. You guys talked about, the mass vaccination clinics being rescheduled this weekend. Are pharmacies also rescheduling appointments or keeping them ahead of the storm? And is there a concern that people may have to last minute cancel after vaccines have been taken out of the ultra cold storage? And then what happens to those doses?
To answer your second part here, no, there's not. If it's taken out of cold storage, we've the Pfizer vaccine was always the one that we were most worried about, but they've actually updated the guidance. You can have it in a refrigerator for up to 2 weeks and then actually refreeze it now that they've determined that one time. So we don't have as much concerns about that. We have been talking with all the pharmacies. They are right now scheduled. They still have their clinics scheduled or their appointments scheduled. They will call if they decide that they are going to reschedule clinics, but they have all agreed that they'll make sure that anybody was scheduled this weekend, if they do have to cancel, they will reschedule them and they will get vaccine in them or vaccine in arms as soon as they can.
Let me also just add that the March 19th date for opening it up, and then by mid-April, everybody, that also relies on the pods that we walked you through the locations on today. Because the one thing is getting the vaccine to the state, the second is getting it to arms. Right now, we are at close to the maximum of our regular distribution system for vaccinating people through our hospitals, through our pharmacies. As the supply increases, we will rely on these high volume pods. We don't expect to max out their volume. They can do 6,000 a day. There's 6 of them. That's 36,000 a day. I'd be thrilled if we have enough vaccine to do all that. But even if that's an additional 10 or 20,000 a day, if they're running to half capacity, because that's a vaccine we're getting, that is an important piece to augment the conventional distribution system through pharmacies and community health clinics and hospitals.
People who want the vaccine being able to get it, but polling has shown there's a pretty dismal percentage of Coloradans who don't want to get the vaccine. Is the state going to start, really leaning into these efforts to tell people that it's safe? How do you get to that 70% number minimum? So
right now we have the problem of demand exceeding supply. That will change soon. It'll change in late April or early May. At some point in April or May, supply will exceed demand. And there's a few things that we do about that. One is convenience, not so much hesitation, but convenience. People that, I get it, but maybe if somebody shows up in the, where I can get it right away, I'll do it. I'm not going to go sign up on some website and, figure it out and go to some pharmacy, but like if it's there, I'll do it. So that's easy. That's a significant part of our population, could be 10, 20%. We're going to make it convenient, right? That means we'll work with employers, middle, medium, and large-size employers to do it in the lobby, do it outside as people come in. We'll make sure it's in pharmacies and supermarkets and it's well advertised and promoted. Then you get to folks who might be a little bit hesitant to get it. And there it's about the increasing comfort, first of all. I think as they see their friends, their neighbors, their family members get it and see that it's no big deal, you'll naturally get decreasing hesitation. But it's also about making sure we have culturally relevant outreach. And we are already working on potential campaigns around doing that. They're not active now because right now demand exceeds supply. But shortly before we expect that supply exceeds demand, we will launch into these aggressive public communication efforts to increase demand. Thank you all very much.